Well, our campaign started at the beginning of the year when we found out that they were going to close LifeWorks, our community centre, down. We have 2 days a week. It's not so much of a community centre as a therapy centre for PD, personality disorders, in mental health. They were going to discharge us back to our GPs with no support whatsoever. And surprisingly for the Trust, who thought that we would just lie down and take it, we said no. We took over our community centre and occupied it 24/7 for 4 months. And that is service users, that is mentally ill patients. All of us had personality disorders, all of us were in various stages of ill health. Some of us became ill while we were there and had to go home. We went round the county, Cambridge and Peterborough. We went round protesting, collecting signatures. We were in the press. We were on the TV. We were on the internet. We went to Parliament. We actually took it to Parliament. It was hard. It wasn't easy by any stretch of the imagination. The things that kept us going was the amount of support we had from the public was just so unbelievable. It really, really was. We cannot thank the public enough for the support that they gave us. It really was unbelievable. We had people from the public knocking on the windows of the centre that we had occupied, bringing us food and milk and donations of money. I mean, it was just so unbelievable. And it's what kept us going at the end of the day with our family and our friends. How we managed to get the campaign together, that was a bit, we took the building over and then it was like, what do we do now? Luckily, a couple of guys from GMB and Unison and Unite came down when they found out about it, and they sort of showed us the right direction to go down. Our county council got to hear about it because what the Trust had tried to do was, because of the new pathway that had come in on all of mental health, new cluster pathways and everything, they had tried to put the community part of it in with the hospital part of it and close it down. And they hadn't done a consultation paper and they hadn't done an equality impact assessment. And it turned out that that was a no-no. The county council got involved, they set up a working group and they forced the CPFT to do proper procedure instead of sweeping it under the carpet. The only sad thing is that all the other community centres that were in Cambridge, they had already done that way and closed them, but not us. We refused to give up our voice and we put up a fight. 4 months down the line, we signed a contract for 5 years. We got them to give us 5 years of LifeWorks. Part 1 of the contract is that we have LifeWorks for 5 years. The second part of the contract is that we now work with the CPFT to try and get something that can go county-wide around Cambridge and Peterborough, so that Peterborough, Wisbech, Huntingdon and Cambridge has a safety net between the discharge of mental health patients from discharge to back to GP, because there's nothing. And LifeWorks brought that up to the CCG. It pointed it out that actually this gap is extremely damaging to a lot of people. People are only getting help in mental health when they are in extreme crisis. And when they're in extreme crisis, there's no beds. And if there's no beds, well, we have to find the money to send them to Manchester and over here and down to London and up there and over there. And family can't visit. So our mission now, which we are working on with the backing of the CCG, is that we've come up with a safety net, which we are working on, which we will hopefully get funding on next year. which we will hopefully trial and pilot, hopefully in Peterborough, to check that it works. And if it works, then that will go around the whole of Cambridge and Peterborough. But I mean, it's not an instant thing, obviously, but it's better than there being absolutely nothing. So that is how we've done, that's what we've managed to achieve with LifeWorks, not just for us, but for everybody in Cambridge and Peterborough with a mental health problem, is that we have hopefully managed to do something with the gap between being discharged from mental health from the cliff edge and being picked up by your GP who is saying, you need help now, and there's nothing there for you.
Questions, please. I'll start with you. I mean, if you haven't taken action, would anybody have listened to you?
If we haven't taken action,
Yeah.
no.
Right, so that's clear. Thank you very much. Next question.
Yes?
What about the press? What kind of press coverage did you get?
We had press coverage in the local press. We had press coverage with Ross Jones and one of the London papers, and we also had press coverage on the internet, quite widely on the internet, and we also had press coverage on Look East and what's the other one?
Anglia.
Thank you. Yes, and Anglia. Yeah.
Kelly.
Can I just ask a very quick question? Who's the chief executive?
Do you really want me to answer?
I think they owe you an apology.
Yeah, it came from your lot, me. Yeah.
Who's transfer? Was it for a pound?
No. Yeah, Amy Thomas.
Anybody else would like to ask a question? Yes, sorry. Yes.
Could I just ask what's the relationship with the clinicians who should have been allowed to perform the service?
In what way?
Well, were they part of it?
No, they weren't part of it.
Expressing an opinion?
When we took over the house, we were told you're on your own. For the first 6 weeks that we were in occupying Tennyson Road, we had no help from the mental health services at all. We weren't allowed contact with any of our case management, our support workers, nothing. Now they're turned around and say, well, actually, you could have come to Fulbourn and you could have actually seen the crisis team and you could have... Oh yeah, tick your boxes. Tick your boxes. But for the first 6 weeks, we saw nobody. They sent down loads of people. They sent down people to do controls on the building. They even sent down pest control, but the only pest in the house was So they did all of that, checking their building, checking the windows, checking this, checking that, checking everything else, but checking actual patients in an NHS building.
I think occupation is a really good tactic, but it has got to come from within, hasn't it?
It has to come from
It
within,
can't be
yes.
from without.
No.
And,
No.
it's sad that the staff didn't support you. Yeah, but
I think
if
that's
they had,
a two-edged sword, though. That is a two-edged sword because you have to remember that the staff, I know now that some of the staff actually did support us, but they've also got to look after their job. It's a two-edged sword for
but how
them
long are we
too.
going to keep saying that?
Yeah.
Jobs are going any rate.
True. True.
Okay. Yes, gentleman at the back, yes.
When will the trial be starting in Peterborough, and how long does the trial intend to last for?
That is still in the planning stages. This is all still in the planning stages. I'm just letting you know that we are actually working on something. And it's the first time that service users have actually been involved from the ground up in putting a service together to help mental health patients actually deal and put input in a service that will be there for mental health patients.
Is there a timetable in place?
We're looking at about a year to a year and a half. So we started it in August, September. We started it in August, September, and we've only just got the backing from the CCG. So it's going to be a while. Like I said, it's not going to be an instant thing, and there are still snags to sort out. But but it's just to give some sort of confirmation to you that when you do this sort of thing, and you do get signed for 5 years, and you do get some input in, and you get them to listen, that you can actually get something more out of it, that you can be able to actually have some input into them doing something and then bringing you in from the ground up and saying, actually, we will listen to what you have to say. And you can be involved, that you do have a voice. Because they actually took our voice away and we said, no, you can't do that. We said, no, you can't do that.
One last one, please, make it short.
These staff, were they unionised? And what did the union...
I don't know. I can't answer that question. I
So
don't know.
were they part of unison? Because if they were, then they should have discussed this, shouldn't they? They should have supported this.
I have to be honest and say I don't know. I don't know that. That's not something that I would have asked them. I'm really sorry, but
No, it's all.
as a service user, well, yeah, and as a service user, I wouldn't turn around and say, well, actually, are you in a union? I wouldn't.
Can I see your union
dawn on
card?
me.
No, you can't.
It wouldn't dawn on me to do that at the time. No.
Next time.
Next time.
Next time.
It sounds like there might be one. Look, if we can get the other speakers to keep it as brief and as sharp as yours, then...
Is that all right?
I think it was fine.